everyone. Welcome to this episode of the Entrepreneur Showcase Series brought to you by Patranya Media LLC and Parkway Media Partners. I'm your host, Patranya Poonswan, and in the studio with us today is Dr.Hu, our special guest. How are you doing today, Jerry?
I'm so excited to be here, Patranya. Thank you for having me. There's a calling for me to be here, and I have so much to share, so I'm very, very thankful and grateful to be here.
So great to see you. And I want to share with our viewers, audience, listener, a little bit about what you do here and your business. You just opened your practice here in Nevada not too long ago, but you are a triple board certified, let me get this right, triple board certified sleep medicine dentist.
Correct.
That's a title. It's probably something that we need to go into a little bit to see what exactly you do and why it's so important.
Sure.
But your business is called Nevada Dental Sleep. Right?
Perfect.
And then, it's just so interesting to me because we think dentist, we think sleep, totally different things.
Correct.
But what you're doing is really connected. Everything is connected. And this is what's so important about what you do. So tell us a little bit about Nevada Dental Sleep. What do you do at your practice?
Yes. So, you've actually nailed it just right there. Currently, the awareness of sleep apnea treatment is using the CPAP machines, whether it's a BiPAP, APAP, or any type of the PAPs, right? The problem is in the medical community, everybody knows it, is the compliance and adherence to that is very, very poor. And so sleep as adults are supposed to be 1/3 of our lives, 7.5 to 8 hours of sleep per night. And it's quality sleep, non-fragmented sleep. But what happens is if you have those arousals or those apnea or hypopnea events, the machine is supposed to help you out. But if you only wear it 3 to 4 hours, what about those other, times where you need that and things like heart attack and serious comorbidities can actually worsen every night after night after night, so that's an issue. Beyond that, the standards that they use to justify compliance is also so low that, as a dentist, I can kind of share an analogy.
Right.
If I do a dental crown on you and if I told you that please only use that crown 3 to 4 days a week and don't use it any other days, you'll think, well, what kind of dentist are you, right? But even if I did a poor fitting crown or a bad crown, most likely you're not going to die from that. However, with sleep apnea, if you don't have the machine plugged in, that could be potentially lethal. And this is where even in the news, celebrities from Reggie White to Princess Leia, Carrie Fisher to Justice Scalia, the official reports say they died not peacefully in their sleep, but they actually choked to death and they were gasping for air and had sleep apnea.
Wow. I did not know that. And, we hear this term sleep apnea, and that's probably the most common, right? When people think about people having sleep issues or couldn't breathe or things like that. And that is what you do at your practice, Nevada Dental Sleep, which is actually located right in Henderson, right?
Yes, absolutely.
You're on Seven Hills Drive.
Yes.
That's where you practice all over. I mean, patients come to you from all over Southern Nevada.
Correct. Absolutely.
So you started, and maybe let's go back a little bit about what you do. You started, were you in Alaska. As a dentist?
Yes.
And in Alaska? Was that your original medical practice?
Yeah, so I've practiced as a dentist for 26 years up in Alaska. By age 24, I owned my own dental clinic, and I was very into the world of cosmetic and implant dentistry. So I come with a very good background in most of all the dental subfields, if you will.
Right.
But my own personal story, and with my parents, is what led me to sleep medicine and how important, because of that awareness issue and because of, people don't know what they don't know.
Right.
So if I can start, the prevalence in the world, in the studies, they show over 1 billion people with a B are underdiagnosed, undertreated with sleep apnea.
Wow.
And when you look at all the different ugly branches that it has, from cardiovascular to diabetes to Alzheimer's, dementia, it's alarming. And so the other issue is that most of the medical profession is very, very undertrained, if you will, with sleep medicine. Now, if you become a board certified sleep physician, you've decided to specialize in that field. So that is, very obvious that they would know everything and anything about sleep. But if you're a primary care physician, if you're a cardiologist, you're a pulmonologist, your experience roughly is about 1 to 2 elective hours of training in sleep. So that's even through residency. So this is why when I look at my example, and if I can share about my own parents, that it's so, hit me at the core, where I believe that this is now a calling for me to help and hopefully move that needle forward a little bit.
So talk to me about that. What happened to both your your dad and your mom, right, with their health issues.
Yeah, and the thing is, I want to make it as positive as possible, but I just want to give raw truth.
That basically drove you to do what you do today, right?
So I lost my father a year and a half ago. And I'm going to just tell the story as it is, but because I wanted to really underscore the importance about the awareness of things that have happened. So my father passed away from Alzheimer's dementia. He also had congestive heart failure and Cheyne-Stokes breathing, which means that he wasn't sleeping well at night. But not one doctor or neurologist or internist or cardiologist ever talked to him about his sleep, right? Yeah. And so I really feel like that because I jumped into dental sleep medicine and offer solutions that are effective, that I believe I've increased his lifespan by 2 years. Wow. But this is what happened when he had hydrocephalus in addition to his Alzheimer's dementia. He was at one of the hospitals here, okay? And it was supposed to be an outpatient procedure, but his clotting time and the factors were not, they were not in check. So it ended up being an extended 2.5 months. And this is through COVID. Right. And during that time, so the nurses, they didn't know I didn't know, right? And so they thought that if you have sleep apnea, you would have one of these machines. But no, he's tried so many trials with the BiPAP and the CPAP, and he failed. He would trip over the cords at night. And he would bruise his, bottom, and things like that would happen. So he can't tolerate that. Yeah. So I was able to give him a dental sleep medicine solution, but the nurses didn't know, and they threw his appliance away. No. So during the hospital, because it was COVID, I couldn't even get in to intervene. And what was really sad is he went into the hospital with stage 1, 2, early Alzheimer's. He left stage 6, 7. And so soon after that, just several months, we lost my father. So that, he was my hero, right? So it kind of affects your heart really deep. And my mother, kind of the same situation. She's now on dialysis. There's wonderful dialysis centers here in Vegas, and that's awesome. But why? What was the root cause? Well, so all these years she had high blood pressure, and it became more and more problematic as she had to add more medication to that. Yeah. So 4 decades, you can imagine, of multiple, from your loop diuretics to your beta blockers, all those different things can do a toll on your kidneys. Right. Well, then her kidney failed, but yet did one doctor ever say, well, Mrs. Hu, what about your sleep? Do you ever choke or gasp for air? And what happens is there's so many things that tax the heart, tax the immune system, tax your diet, your energy, all of it, right? Because when your oxygen desaturates, where it gets low at night, your body isn't doing what it's supposed to be doing. When it is sleeping well, it's in parasympathetic mode. And that's where things can recharge. And especially in REM, when your brain's recharged, it's important that we say parasympathetic.
So you saw in both your parents how sleep was so critical.
Yes.
And it could have changed maybe the course of their lives because of that. And because of that, now you're kind of bringing this in light with your practice so that people see how important it is. And this is not just for older people.
Correct.
But you also work with children. And I think what's really important about your practice is that when it comes to pediatrics, when it comes to sleep issues, you're probably practically the only doctor here.
I am, and I'm going to tell you, I'm just wanted to say, I think this is meant to be, because like we were talking earlier about the Vegas population's growing, so there's probably going to be 2.5 million real soon here. Yeah. It's so, the awareness, the undertreatment, the underscreening is so bad, and there's often in children misdiagnosis. So now imagine, it could be from allergies, it could be if they were properly breastfed, a whole slew of things that could occur to make the child compromising every night, and they're not breathing well. Well, that compromise causes, for example, their tonsils to swell. Well, if their tonsils are swollen and they're kissing, if you will, how is an oxygen molecule going to get to the lungs, right? It's going to have a hard time because there's so many obstructions. And so with that, you're not sleeping well, then guess what? You go to school, you can't be alert, you can't, your memories, your brain fog. In every child's different. Sometimes they respond by being hyperactive, or some respond by just being kind of in a daze. And then the teacher doesn't know what she or he doesn't know. And guess what? They say, well, maybe this child behavior-wise has ADHD or oppositional defiant disorder, ODD.
Things they've heard about, and they just associate with the children.
So then they would lead or guide either the school nurse or the parents to a path that ends up being big pharmaceuticals. And I want to say that, in certain situations when it's really, truly a behavioral issue and not something the root cause is different, such as your airway. I mean, if I choked you 200 times a night, every night, I don't think you can function normal in a day. You'll be irritable. You'll be, very, very easy to have a temper tantrum. And then in the end, if I give you Ritalin or Adderall, which is really speed, that's just how they're, treating that. And so for me, I can actually orthopedic-wise, grow out their airway with myofunctional therapy and offer solutions. And this is it's so amazing because, back to Alaska, the sheer numbers of people and where I can make an impact, of course, being in Vegas, 2.5 million versus 700,000 in the whole entire state of Alaska. So, it's, again, kind of connected to that calling thing. But I'm actually taking on a Down syndrome child because they're brachycephalic. They have actually other challenges and things.
And they can't communicate.
But they're trying to breathe. They're trying to, so they've already have like an uphill battle, if you will, to go through. But the parents of that child, it's a state trooper and the mother's a teacher. And you won't believe it. This child stopped thumb sucking. We're getting him to do the oral appliances and the myofunctional therapy, and like even the parents. And this is something that money can buy. When you can see a child thrive, get better at school, join sports, it's like I'm giving kind of goosebumpy right now. Just think about that. And it's so funny too that you thought, well, as a dentist, I thought it'd just be my life doing fillings and crowns and things like that. I had no idea that, first of all, that it's I want to stress it's really truly a calling because I can make quality of life changes that make a person be at their fullest potential every day.
And that is so powerful. And you talked about your journey with your mom and dad, but also you went through your own journey. And I think we have a picture showing, you when you were younger and now as you're older and the changes you made in your health.
Yes.
So talk to us about that.
So I had been an overweight child, and for the most part of my life until I addressed my own airway sleep apnea issues, I was a stress eater. And so I'm 110 pounds heavier than I am now. Okay. Wow. And so, of course, going through dental school and going through that it's pretty stressful. And in dentistry, we're kind of doing microsurgery every day. So very focused on a millimeter or two. And there's just a lot of stress, people.
So even in college you were?
Yes, way overweight.
Wow.
And it was hard I tried different diets. I tried different exercise plans. And sometimes I would lose maybe 30, 40 pounds, but it was hard to keep it off because my leptin and ghrelin hormones, which is regulated in 3-delta slow wave sleep, but it's something that, we think about our hormones, our immune system, all of that is so important during sleep. But if you don't have quality sleep and sleep architecture that's appropriate, those get affected. And then now, anything that would be stressful, or if I'm cramming for exams, or if I'm, I would eat. And the thing is unfortunately, when you don't know what you don't know, you also pick the easiest things to eat. The fast food, the ones with preservative. We all know if you put some of these fast food burgers in your lawn for like a month, they'll never grow mold because they have so much preservatives. If they finally use real chicken and chicken nuggets, then you're like, well, what were we eating before, right? So all those things really made that challenge for me. And so once I was able to get my sleep apnea addressed, it is a really holy cow factor. Wow. It's not just the energy, it's the food nutrition, which is so part of the whole integral picture. I believe that nutrition, exercise, sleep, and mental health, they're the 4 pillars that hold the table together.
And a lot of times sleep is just kind of put to the side. People don't think about that.
And so after that, I got my black belt in karate. Can you imagine? So a kid that was always last to be picked in PE, right? I hated that feeling whenever the PE teacher said, hey, you know what? Let's just split up in teams for soccer or for basketball. And if I'm the captain, that's okay because I don't get embarrassed. But, if you're like just to pick me last, I know I'm not going to be, and then the Presidential Fitness Awards, you have to go do those chin-ups and that rope, that dang rope. No, I can go like 2 inches.
Like your worst
and then
nightmare.
I fall. And so to come out of that, I mean, seriously, all the colored belts you tie on yourself, but the black belt the sensei ties on you. So you can imagine that day for me, right, in front of my family. I don't mean to get emotional, but it really was. After the endurance test, literally it was an 8-hour ninja crunches, burpees, like nonstop. I wanted to die. Then you got to do your katas, and then you have to do your sparring, right? And then when you finish and your sensei looks at you and then ties you, I just started bawling. I mean, to do that and to be able to do that, I would never thought, my gosh, that's all rooted in my sleep. It's all rooted in those hormones and those stress and all that. So Prior to that, I had acid reflux. I have multiple medications for hypertension, blood pressure, all those things were going on. My employees, my team members always say, "Oh, doc, we need to take your blood pressure." We just see it, we would go on a mission of mercy thing where it's throughout the U.S., but you're donating to the public restorative dentistry and stuff. And I remember just after a couple of procedures, my shirt was wet. I was all sweaty. I'm sure my blood pressures, even though with medication, wasn't really controlled well. And that life versus now losing the weight. And I'm certain CrossFit moves like toast the bar and things like that. I can do that. And I was just, juxtaposing those things in my life. So if I can do that, and what has happened to my mom and dad, and this is such, I also teach dental sleep medicine. I'm on the faculty of the Medical University of South Carolina. Right. I do clinical research, and I have 5 patents in sleep medicine. So I'm also looking and identifying what's missing and trying to invent things, IP, to help move things forward. So you can see I'm super passionate about this, and coming here into Vegas Valley, knowing what you've identified, like the pediatric aspect, right? As well as even the geriatrics, where I'm going out to Sun City Anthem, to all these even nonprofits to really bring that awareness, because, hey, this is my oldest got into medical school here, so that's really the main factor where, there's a beautiful story with that, but long story short, I'm here to make an impact and hopefully make Vegas eventually be like a center for people to go to talk about sleep and sleep treatment options and, all the stuff that's really not spoken and not, people aware. Even like COVID, like during the pandemic, I'm talking about immune system and cancer, all those things tied to oxygen deprivation.
How everything tied to sleep, just really amazing to me. And, let's talk a little bit about the treatments and what you offer. If people wanted to come to Nevada Dental Sleep Practice, and you brought some props with you, do you want to just talk briefly about what you offer there?
So this is the standard that people would get with the machine, and there's different types. There's ones that are cannulas, but there's several important things I want to bring attention. So a couple of years ago, Philips Respironics recalled over 70% of these machines because they're blowing carcinogens down people's airway. Oh, wow. So this can be like class action things or whatnot, but it's very serious. Not only that, as a dentist, when we talk about flossing, honestly, we don't think everyone flosses every day like they're supposed to. I mean, that's just to be honest,
it's
right?
reality.
Yeah. And so I'm thinking of that compared to how you're supposed to clean a CPAP machine. Yeah. And yes, they have cleaners, but the way that you have to air dry some of the hoses and stuff, because that's bacteria, that's biogunk. So if you're blowing the biogunk in your, airway, that's as if, well, why would you even do a dental cleaning? Because you're worried about that bacteria. That bacteria can, so there's issues pretty much with this. And even if you were compliant wearing this, there's other things like the bed partner noise, the portability of this. There's a thing called aerophagia. If the air goes in the wrong way, you'll get bruised or you get eyes that are really swollen. So those things are very important to keep in mind. And honestly, almost everyone I've spoken to, they are not compliant with this 7 nights a week at 7.5 to 8 hours. At best, they're probably 2 to 3 days and do 3 or 4 hours.
So you provide, this is one option.
This is option that I won't provide because the sleep centers provide this. And this is what they do.
So this is something that you're not providing.
I'm not providing.
Okay, but you want to show us so that is this something that's been going on? It's not. So what do you work with?
So I work with this, and it's almost like if I can have sound effects like ding. So this is actually super important that people realize that a lot of sleep apnea is an obstructive thing about the collapsibility of your airway. Yeah. And so all the research and all the evidence based show that if you're able to position the jaw or the mandible, and when you consider 3D evaluation, and you have to have the equipment. One of the things that also distinguishes me is I just don't do things either the cheap way or skip steps. No, I'm going to fork the money out. You have to get loans to get the proper equipment to measure and to calibrate and to find people's target position. Why? Because compliance is key. And I think tied to compliance is comfort. Yeah. So a lot of the reasons why this fails is because it's also not comfortable. It's loud and noisy. Yeah. So when we have an oral appliance such as this or this, and it's
they're called what again?
They're called customized oral appliances for sleep apnea.
Got it. So they wear that?
They wear that at night.
Okay? At night.
So you can imagine, so when I was lecturing to the soldiers in Hawaii, there's also Air Force and a military base in Alaska, when they go and they fight for a country and they have to carry a CPAP machine and it's supposed to be solar powered, well, good luck if it's overcast skies, right? And they were showing me, like they're saying, and this is very emotional because when Colonel Neal, when he walked out, he was telling about this alternative that works and it's validated with all the science, people were like, oh my gosh. And all he did is he pulled it out of his side pocket because, those uniforms, they have all these different pockets. Right. And I was just like really moved emotionally by that because he says, they were showing pictures. He said, yeah, you think that, we're in a bombed out shack in, Afghanistan or somewhere that we have bunk beds. No, this is what it looks like when we sleep. And you'll have like 10 soldiers there. And if 2 of them snores and 3 of them gasp for air, nobody's sleeping, first of all. Yeah. And they're supposed to be combat ready. If they're driving tanks, if they're saving their own lives.
It's life and death for them.
It's sleep. Yeah. American Automobile Association did a study. And this is a very neutral because they're just with automobiles. They found in 2018 that over 28% of all U.S. fatal car crashes were due to people falling asleep at the wheel. So in the Army, so they did this thing that's really kind of correlated to this subject about the military, is that when you have a DUI and you're drunk, that means your license is taken, right? And you're a day in jail, all those things, right? That's that serious because you can kill people and kill yourself, whatnot. Right. And so when they looked at 6 hours of sleep, you're already at the legal limit or worse. If you're 4 hours of sleep, which is this is the main thing about that. The Army says if you sleep more than 4 hours, there's something wrong with you. You're not tough enough. And I'm thinking, excuse me? I mean, okay, first they're fighting for our freedom, their combat readiness, their response time, right? Yeah. And it's interesting too, because there's a lot of scary things. At least when you're drunk, you try to swerve off the road, but when you fall asleep,
it's unconscious.
It's
so, you have so much information. This is a lot. I mean, I can talk to you for hours.
Me too.
And you have a lot to tell me for hours. But we have such a limited time here. But I want to make sure that people know that you are a resource here in this community.
Absolutely.
That you, Nevada Dental Sleep is here, and they can come to you and just consult, right?
Yes.
And just get more information.
Absolutely.
No matter how old, you work from kids to older people, as you said.
Yes.
What else before you go that you want to tell people here in Southern Nevada about you and your practice?
Well, I think the one main thing, my overall big picture, is really back to that $1 billion number. So ever since Sullivan invented the CPAP machine, which is really a vacuum cleaner inverted, blowing air down, the needle has not moved forward in prevalence. And so my goal really, first of all, because I'm so emotionally, you can tell I'm so passionate about this because it ties to my family, my history, but I really want to be able to grow and impact. I'm going to all the different centers, from lung centers in Nevada to Nevada Heart and Vascular. I'm trying to spread that message, but it's really bigger than me. It's bigger than you. It's bigger than all of us, because this is kind of like the silent killer, if you will, the silent thing that people don't talk about, but yet it can lead to things like prevention for Alzheimer's, dementia, and get kids to thrive and function at school.
And you've seen this all in person.
And yes, I've seen parents cry for their kids. I've seen one administrator in Alaska. He flies to the rural bush area, and he showed me his driver license before I involved, because it's not just about the sleep. I also talk about nutrition, exercise. I try to do interdisciplinary approach. So then afterwards, he's kind of like me. You don't even recognize the same person, and he has to do so many heroic things. I mean, because out in the bush area, the access to everything is so, difficult for them. And he just cares about education. But you know what? I'm like, me as a dentist who's supposed to be a tooth doctor is able to make this administrator at school go fly to rural areas of Alaska and help the natives out there, right? And help with their education, but have that energy, have that ability to be at his fullest potential. And to even, you can see just the whole person, it's crazy. So if I can do that here, that's amazing.
And thank you so much for sharing this. I know this is just a small part of what you do here in this community, but I would really recommend it. People even think about, because it's clear that it's not just about sleep for you, but just the whole body and health and nutrition. And I think you can offer this community so much.
Thank you.
Dr. Hu, thank you so much for being here with us today and sharing your expertise and just being here in Southern Nevada. I think this is why we need you and your practice. So again, if you want more information, you can go to Nevada Dental Sleep. That is a service. And I think your phone number is 702-478-8869.
Correct,
they can go there. And just look up Dr. Hu. He's going to talk your ears off and tell you his whole life story and just really inspire you to really take care of yourself from the inside out, especially your sleep. You're just making me think now, how many hours do I sleep at night? Because I need more. But anyways, Dr. Hu, thank you so much for being here. And thank you so much, everyone, for watching and listening on our show today. And we'll see you again next time.